Administrator, St. Raphael Health Center. We are engaged in basically 3 departments. We have the maternity department, our strong income generating department. Then we have the outpatient section, that is where prescription of drugs is done. Then the other department, we have the inpatients department. It's basically where bed rests are given. Behind the inpatients department, we have our laboratory. That is where most of the tests are done. We have HIV testing in the laboratory. We keep drugs in the laboratory for immunization. We always immunize every Tuesday. We also test for typhoid. Of recent, we are starting testing for syphilis, but basically that will be under the maternity section, because before taking a pregnant mother under antenatal services, syphilis is also tested. Also a product of Stepping Stones Foundation of Hope. I'm really grateful to our dear sponsors. I'm a fresh graduate from Tesa Royal University.
I'm John Baptist of Kenya. I was born in Bunamweri and I'm a resident of Bunamweri, and I'm a product of Stepping Stones Foundation. Okay, this is where I do clerking, like take patient's information, what the patient is being affected for. This is my chair where I sit. This is the table. This is the examination bed. This is where I examine patients from. And then
this is our outpatient section, where prescription of drugs is done. We have our shelves where we fill them with syringes, just because we have a little few inside here. So inside here is our inpatient section. This is where bed rests are done. This is where bed rests are given.
And admitted patients.
And admitted patients are always received from here. So inside here, behind here is our...
This is an admission bed. Yeah.
Inside here is our laboratory. Inside the laboratory, what we do different tests. There is testing for malaria. There is HIV testing. Of recent, we've introduced testing for syphilis, and this instrument here, we keep drugs of immunization. Immunization is done every Tuesday, and it's basically free of charge. So inside here is our pharmacy. This is where drugs are obtained and then taken to the outpatient section, where prescription of drugs is done. Basically, that is what is done inside here, inside our pharmacy. Then behind here is where, when we get pregnant mothers who are expected to give birth, this is where they are first placed, then later examined and taken to the maternity section.
This room is used for prenatal care. When the mother is pregnant, mothers are supposed to come and get examined. So we examine them here, and we give them advice on how to take care of their pregnancy, the drugs that they are supposed to take, the drugs that they are not supposed to take, and we advise them on how to prepare for delivering their baby when time comes.
It's the office of the administrator. This is where administrative work is done. Up there in those shelves is where files are, is where we keep hard copies. After documenting them from here, then we keep the hard copies. What is done basically here, we generate reports, we monitor finances, so many activities.
This is a buffer store for the drugs. We always get them from here when they are done from the other pharmacy.
When we incur stock, we bring it directly here. Then when it gets a little bit like almost getting done from there, from the farmers. We come and pick from here, then take to the inside. Here is our maternity ward. This is where normal delivery is done. These beds are not always having sheets, as in regards to health. They are not meant to have sheets. We have some of our instruments here.
The label, this is the delivery coach. These are just screens. This is the baby's bed that we put the baby after delivering and doing some other things on the mother, so we keep here the baby. This is a drip stand in case we need to give some medicines to the mother. And this is, we call it an autoclave. We use it to sterilize equipments. That's what we use for. Then this is our weighing scale. Whenever we deliver a baby, we have to weigh his or her weight to assess the nutritional status of that baby. Here in the shelf, we keep some of the drugs and then equipments. These are IV fluids, and these are drugs that we use in the process of delivering the mother.
Ono omwana ye Nakabale Raphael twamuzaala July 2 twali nga tulina olugendo luwanvu ng'ogenda otuuka oluusi oyinza n'ozaalira mu kkubo n'abasawo ng'abakambwe tulira bulungi nnyo.
On top of the services that we offer here, we would like to include more services like the dental services. So in this case, we would like to have a dental department. In a dental department, we need a lot of things to start it up, but the most important thing is the dental chair. Then we would also like to introduce the radiography department. This includes the ultrasound scan and an X-ray. We need also to improve this room, like it is not wide enough for us, and it lacks auditory privacy. Patients are not free to talk about their health problems because they are heard by other people. So we need privacy, both physical and auditory. Then we need to improve our windows. They have to be in regard with the health standards. These are not meant to be in a health facility. So we need to modify them so that they can meet the health standards. And then we need also to improve the ventilation. The ventilation has to take 30% of the total coverage of the room. So we need to modify everything about here. We need to modify the building, the whole building. It was meant to be a residential building, but now we are using it as a health facility. So we need to modify it. We need another refrigerator because this is meant for immunization drugs only. But we have our other lab reagents that we need to keep in a refrigerator.
We have plans of modifying our office to include, we want to have some photos this side, We want to add on some other shelves for still keeping documents, hard copies basically. We intend to have a printer for producing out hard copies to minimize on expenses of going for hard copies, yet we can still obtain it by ourselves. That is in case we have a printer in place. We still have this. These are seats, but it could serve much more better than that.
Yeah.
Modernized chairs still could work in case we access one, to avoid this as a matter of improving the office appearance. This is the oxygen concentrator. We don't basically use it as of now, given the fact that after testing it, we realized that it requires much power. It cannot be supported by the solar system that we have, so that's why we are not using it as of now. Otherwise, it could be functioning in case we had strong power.
Here we need more improvement in the labor ward. As we can see, it doesn't reach the standards of the labor ward. So we need to improve the floor. We need to have a drainage system where we don't need to touch in the fluids of the delivering mothers. So we need the drainage system. We need also to improve the
ventilation.
You can see we have very little ventilators here. And then
we also need to improve on the appearance of our floor. We also need some reception seats. Most of these requirements were mentioned in our budget of 2019. I wish to acquire them God willing this year.